Picture this. You go to bed tonight feeling perfectly fine. No chest pain, no dizziness, nothing unusual. You close your eyes and you never open them again. No dramatic warning, no chance to call for help, just silence. This is not a horror story. This happens to hundreds of thousands of people every single year, and most of them had no idea they were at risk. Here's what nobody tells you. The hours you spend asleep may actually be the most dangerous hours of your entire day for your heart and your brain. And the scariest part? The habits putting you in danger are probably ones you've been doing for years, thinking they were completely harmless. In the next few minutes, I'm going to walk you through 5 nighttime habits that silently damage your heart while you sleep. And I'm going to show you exactly what to do instead, starting tonight. Stay with me. This could be the most important thing you watch all year. Every week, I talk to patients in their 60s and 70s who are shocked to learn that what they do before bed has a direct impact on their risk of having a heart attack or stroke during sleep. Most people focus on diet, exercise, stress, but almost nobody talks about what happens between 10 p.m. and 6 a.m. And that's a serious problem. My name is Dr. Isabel Greer. I'm a cardiovascular health specialist with over 10 years of clinical experience working with adults over 60. I've sat with patients after they survived nighttime cardiac events. I've also sat with families who weren't so lucky. What I've learned is this: many of these events are preventable, not with expensive treatments, not with complicated procedures, with simple changes to what you do every night before you sleep. That's exactly what this video is about. Important disclaimer: everything in this video is for educational purposes only. It is not a substitute for personalized medical advice. Always talk to your own doctor before making any changes to your medications, routine, or health plan. I'm here to inform you. Your doctor is here to treat you. Now let's get into it. Here are the 5 nighttime habits that are silently putting your heart at risk. Point 1. Eating late and eating heavy. Let me ask you something honestly. What time do you usually eat dinner? If your answer is 8 p.m., 9 p.m., or later, I want you to really pay attention here. Most people think of a late dinner as a small inconvenience. Maybe a little indigestion, maybe some bloating. No big deal, right? Wrong, dead wrong. And I use those words deliberately. After the age of 60, eating a large meal late at night puts your heart under enormous stress at the exact moment it needs to rest. Here's why. When you eat, your digestive system needs blood, lots of it. Your heart has to pump harder to move that blood to your stomach and intestines. Your blood pressure rises. Your metabolism speeds up. All of this happens when your body is supposed to be winding down and preparing for sleep. Think of it this way. Imagine asking someone who just worked a 12-hour shift to sprint a mile before they're allowed to sleep. That's essentially what a late, heavy dinner does to your heart. A major study published in the European Heart Journal tracked over 100,000 adults over several years. People who regularly ate late had a significantly higher risk of nighttime heart attacks and strokes. The mechanism is straightforward. Late digestion raises triglycerides in the blood, increases inflammation in the arteries, and, critically, disrupts the natural nighttime drop in blood pressure that your heart depends on to recover. And there's one more danger here that almost nobody talks about. A full stomach increases acid reflux. Acid reflux can stimulate the vagus nerve, a nerve connected directly to your heart. In older adults, this stimulation can trigger dangerous heart rhythm disturbances. I had a patient, 71 years old, active, healthy-looking, who had eaten heavy dinners at 9 p.m. his whole life. One Tuesday night, he had a heart attack in his sleep. His wife called 911. He survived, barely. When we talked in recovery, he told me, "I thought I was fine. I felt fine." The solution? Eat your main meal earlier. Aim for 6 or 7 p.m. Keep it light. Lean proteins, vegetables, easy to digest carbohydrates, smaller portions, less salt. Your heart will thank you before you even close your eyes. Stay with me, because habit number 2 is one that millions of people are getting wrong without realizing it. Point 2. Skipping medications or taking them at the wrong time. If you take medication for blood pressure, cholesterol, or to prevent blood clots, this point is absolutely critical. I want to be very direct with you here. Skipping doses or taking your medications at the wrong time is not a minor mistake. It can be the difference between waking up tomorrow and not waking up at all. Here's what's happening inside your body while you sleep. Your blood pressure follows a natural rhythm throughout the day and night. In healthy people, it drops during sleep, what doctors call the dipping pattern. This drop is protective. It gives your heart and arteries a break. But in many adults over 60, this doesn't happen. Blood pressure stays high at night, or even rises. This is called nocturnal hypertension, and it's far more common than people realize. Most people with it have no idea because it happens while they're asleep. When blood pressure spikes at night and your medication has worn off or was skipped entirely, something dangerous can happen. Those spikes can rupture fatty plaques sitting inside your arteries. A ruptured plaque creates a clot. That clot travels to your heart or your brain, and you never feel it coming. Research published in The Lancet, one of the most respected medical journals in the world, showed that properly timed blood pressure medication can reduce nighttime cardiovascular risk by nearly 50%. 50%. That's not a minor benefit. That's life-changing. I remember a patient of mine, 66 years old, a retired teacher. She had high blood pressure, well managed with medication, but she was forgetful. She'd skip 2-3 days a week. She told me it wasn't a big deal because she felt fine. She had a stroke during the night. She survived, but her left side was affected. She spent 6 months in rehabilitation. Please, take your medications, take them consistently, and ask your doctor specifically about timing, because for some medications, taking them at night rather than in the morning can significantly improve their protective effect while you sleep. This is not about being rigid, it's about being alive. Keep watching. Habit number 3 is something most people write off as just snoring. Point 3. Undiagnosed or untreated sleep apnea. Raise your hand if someone has ever told you that you snore. Now, what did you do about it? If your answer is nothing or I just sleep in separate rooms, I need you to understand that snoring, especially loud, chronic snoring, is not just annoying. It can be a sign of something that is actively threatening your life every single night. Sleep apnea is a condition where your breathing repeatedly stops during sleep. Not once or twice, hundreds of times a night. Each pause can last 10, 20, even 30 seconds. Every time your breathing stops, your oxygen levels drop. Your brain detects this as an emergency. It floods your body with stress hormones. Your heart speeds up, your blood pressure spikes, your blood vessels constrict, and then your breathing restarts, and the whole cycle begins again. Now multiply that by 200, 300 times a night, every night for years. What happens to a heart that is put through that kind of stress, night after night? Large studies from major universities have shown that untreated sleep apnea triples the risk of nighttime heart attacks and quadruples the risk of strokes. Quadruples. That means 4 times more likely. The warning signs are loud, chronic snoring, waking up gasping or choking, morning headaches, extreme tiredness during the day, no matter how long you slept, blood pressure that is hard to control even with medication. I had a patient, 68 years old, retired engineer, fit, active. His wife told him for years that his snoring was terrifying. He laughed it off. One night, his oxygen dropped so low during a pause in his breathing that his heart rhythm became dangerously unstable. His wife called 911. He survived. He got a sleep study done, and within 2 weeks of starting treatment, his blood pressure dropped, his energy returned, and he told me he felt like a different person. If you snore, if you wake up exhausted, if your blood pressure is hard to control, please ask your doctor about a sleep study. This is not something to push off. Sleeping on your side can reduce symptoms, but it is not a cure. Get a proper diagnosis. We're halfway through. The next 2 habits are ones most people genuinely don't think of as dangerous at all. Point 4. Going to bed dehydrated. Here's something I hear from patients all the time. I stopped drinking water after dinner because I don't want to get up in the night. I completely understand. Getting up at 3 a.m. is frustrating. Nobody wants that. But going to bed dehydrated is quietly dangerous. And this is especially true after the age of 60. Here's why. As we age, our sense of thirst weakens. You may not even feel thirsty at night, but your body is still losing water while you sleep. Through breathing, through perspiration. If you're already low on fluids when you lie down, your blood starts the night thicker than it should be. Thicker blood moves more slowly through your veins and arteries. Slow-moving blood forms clots more easily. And here's the dangerous combination. While you sleep, your heart rate slows and your blood pressure drops. When your blood is already thick on top of that, circulation to your heart and brain can become dangerously reduced. This is one of the key mechanisms behind ischemic strokes that happen in the early morning hours. A study in the Journal of Cardiovascular Disease found that even moderate dehydration raised the risk of nighttime cardiovascular events by over 60%. I had a patient, 72 years old, who told me proudly that he never drank anything after 7 p.m. "Keeps me from getting up at night," he said. One morning, his wife found him confused and unable to speak. Imaging showed a clot had blocked an artery in his brain. His blood was unusually concentrated. Dehydration was a contributing factor. The fix is so simple. Drink a glass of water about 1 to 2 hours before bedtime. That gives your body time to process it before you lie down. Use the bathroom right before bed. Keep a small glass of water on your nightstand and take small sips if you wake up thirsty. That's it. Small habit, huge protection. One more habit to go, and this one surprises people every single time. Point 5. Sleeping in a room that's too hot or too cold. Nobody thinks of bedroom temperature as a heart health issue, but it is, and the science on this is very clear. Your cardiovascular system is sensitive to temperature, especially during sleep. When the room is too warm, above about 24 degrees Celsius or roughly 75 degrees Fahrenheit, your body works overtime trying to release heat. Your blood vessels dilate, your heart rate increases, you lose fluids through sweating, your blood pressure goes up instead of down. This is the opposite of what your heart needs during sleep. Research from Harvard Medical School showed that sleeping in a room that is too warm significantly increases nighttime cardiovascular stress in older adults. But here's what surprises people. Extreme cold is just as dangerous, and sometimes more so. When temperatures drop too low, your blood vessels constrict. This makes your heart work harder to push blood through narrower vessels. Blood pressure rises. For an older adult with any degree of arterial stiffness, which most people over 60 have, this added pressure can be the final trigger for a heart attack or stroke. European epidemiological data has consistently shown spikes in nighttime cardiac events during cold snaps, particularly in adults over 65. Think of it like a garden hose. If you squeeze the end of the hose, the water pressure behind that squeeze goes up dramatically. That's exactly what cold does to your blood vessels, and your heart is the pump fighting against that squeeze. The optimal sleeping temperature is between 18 and 22 degrees Celsius, roughly 65 to 71 degrees Fahrenheit. In this range, your heart rate stays stable, your blood pressure regulation improves, and your sleep is deeper and more restorative. Check your bedroom thermostat tonight. This is not about comfort. This is cardiovascular protection hiding in plain sight. Now that you know the 5 habits that put your heart at risk, let me give you something practical. A simple, step-by-step evening routine you can start tonight. 6 to 7 p.m. Eat a light dinner. Lean protein, vegetables, small portions. Avoid heavy fats and excessive salt. 7 p.m. Drink a glass of water. Take any evening medications as prescribed by your doctor. 7:30, 8:30 p.m. Wind down gently. A short walk, some light reading, quiet music. Avoid stressful news or intense screen time. 9 p.m. Prepare your sleeping environment. Set the thermostat between 18 to 22 degrees Celsius. Dim the lights. Place a small glass of water by your bed. 9:30 p.m. Use the bathroom. Empty your bladder fully. Take any final prescribed medications. Bedtime. Choose your sleep position carefully. If you snore or suspect sleep apnea, sleep on your side with good neck support. Avoid lying flat on your back. If you wake during the night, move slowly. Sit up before standing. Take a small sip of water if needed. Give your body 30 seconds before you stand up fully. This routine directly addresses every single risk factor we just talked about. Research on circadian blood pressure and sleep safety suggests that a consistent protective routine like this can reduce nighttime cardiovascular stress significantly, in some studies by more than 40%, and it costs nothing. Let's go over it one more time quickly. 5 nighttime habits that are silently putting your heart and brain at risk after 60. 1. Eating late and eating heavy. Your heart needs rest at night, not overtime. 2. Skipping or mistiming your medications. Consistency protects you while you sleep. 3. Untreated sleep apnea. If you snore and wake up exhausted, get checked. 4. Going to bed dehydrated. Thick blood in a slow, sleeping heart is dangerous. 5. Wrong bedroom temperature, too hot or too cold, both increase cardiovascular risk. Each of these habits alone is a problem. Together, they can be deadly. The good news? Every single one of them is fixable, starting tonight. Your heart has been working for you every minute of every day for over 6 decades. Give it the night off properly. If you found this helpful, consider subscribing. Every week, I share clear, practical health information designed specifically for adults over 60. No jargon, no fluff, just information you can actually use. And please, share this with someone you love. A partner, a sibling, a friend. You may not know whose life you protect. Sleep well tonight. I'll see you in the next one.